for this manner by applying the force via mobilization techniques. Tensile strength of the tissue should be increased. I remember that I told you about stress-strain curve or load deformation curve. What is the meaning of tensile strength?
Elongation of the structure.
Tensile strength. Pay attention to this terminology. What is the meaning of tensile strength based on the load deformation curve?
It's mean when we have elongation in the structure, it's come back to the
No. It was plasticity. What is the meaning of tensile strength? Do you have any idea? We apply a load and then we can see some amount of elongation. And if I increase the load, what happens? Suppose a material. I apply the load. If it is a flexible, you can see that it is elongated. I apply a load and it should be elongated. And if I continue to increasing to my load, what happens finally?
deformation.
It's failure. It's breakdown. It's breakdown. Okay? Before the breakdown of this material, the amount of load that tolerated by this material is named as maximal tensile strength. So, with different tensile strength, the stability of the materials should be changed. Maybe the tensile strength of this pencil is very higher than the tensile strength of the plastic rubber. Okay? So, with applying the techniques of mobilization, the tensile strength of the ligaments and capsules around the joints should be increased, and it is benefits for the normal biomechanics of the joint. And also, by use of the neurophysiological pathway, the pain by use of this technique should be decreased. Okay? And again, by use of the another neurophysiological pathways and different techniques of mobilization, the relaxation of the muscles around the joint will be happened. We will talk about the mechanism underlying each of these effects later. Also, there is some contraindication for application of joint mobilization. For example, hypermobility. If I have a hypermobile joint that is prone to subluxation or dislocation, we should avoid the techniques of mobilization. Or if there is inflammation or effusion as a severe or acute phase, you can avoid the application of mobilization techniques. And again, the indication for mobilization is decreased pain, decreased muscle guarding, and maintain or increase mobility of the joint. How about the decreasing pain that achieved by use of the mobilization techniques? When we apply mobilization techniques, we are stimulating the A fibers that are large A fibers around the joint, and by use of the gate control, the pain should be decreased. Who can explain gate control theory for suppressing the pain in our body? Do you pass physiology?
Yes.
Yes. The pain control is very famous theory that it's used in so many devices. Do you pass electrotherapy?
Yes.
Do you know TENS?
Yes.
The pain working based on the gate control theory. Who can explain it?
You mean the translation of action potential from nerve to muscle?
Action potential?
Yeah, by neurotransmitter and electrical transmission.
It is not regarding to the contraction. It is sensory fibers. Just sensory, not motor. Another one? How about the AI? It is good?
No, I haven't noted it, but
I'm going to. Okay.